Have you ever considered that a simple trip to the restroom during the night could turn perilous? Most people don't give much thought to their nighttime routines, but as we advance in age, seemingly insignificant errors can lead to grave outcomes. The reality is, certain practices after the age of 70 can silently elevate the likelihood of falls, heart complications, and other medical emergencies, sometimes with tragic consequences. In this video, we are going to reveal 6 nighttime habits that older adults must avoid. These practices might appear innocuous, but they can place undue stress on the body, rendering it more susceptible during the night when its inherent defenses are weakened. If you're watching this video, comment "interesting" below. By identifying these risks and implementing minor adjustments, you can safeguard your health and enjoy more secure sleep. Stay tuned until the end because the final habit on this list is something that numerous individuals do without even realizing its potential danger. Let's get started. 1. Let's discuss the habit of rising too rapidly from bed. One of the most hazardous routines that seniors can develop is getting up too suddenly after being in a lying position. It might seem like a trivial action, but the repercussions on the body can be abrupt and critical. As we get older, our blood pressure regulation becomes less effective, making us more vulnerable to a condition known as orthostatic hypotension, a swift decrease in blood pressure upon standing. This can result in lightheadedness, loss of equilibrium, and in many instances, unexpected tumbles. For older individuals, a fall in the middle of the night can be devastating, leading to fractures, head trauma, or even more severe issues. The primary concern is that these indicators don't always manifest instantly. Some individuals stand up and feel all right for a few moments, only to abruptly lose consciousness or coordination as they take their initial steps. This is particularly risky when getting up to use the bathroom at night, when the body is still in a relaxed state and not fully alert. The transition from lying down to standing up too quickly imposes an immediate burden on the cardiovascular system, compelling the heart to exert more effort to adjust. If the heart cannot respond swiftly enough, the brain experiences a temporary shortage of oxygen, causing dizziness or even fainting. Take, for instance, the case of Howard, a vibrant 76-year-old from Nebraska. He had always been self-sufficient and never hesitated about his nightly trips to the bathroom. One night, he awoke as usual, swung his legs over the edge of the bed, and stood up quickly. Before he could take another step, his vision blurred, and within seconds, he lost consciousness, collapsing onto his bedside table and hitting his head before falling to the floor. When he regained consciousness, he was disoriented and in pain. He later discovered that the sudden drop in blood pressure had caused him to faint, and he was fortunate not to have suffered a serious brain injury. The key to preventing this kind of fall is straightforward yet effective. Allow your body time to adapt. Instead of leaping out of bed immediately, take a moment to fully awaken. When you wake up, remain lying down for a few extra seconds and take slow, deep breaths. Then, gradually move into a seated position and rest there for another moment. This provides your body with the necessary time to stabilize your blood pressure before you stand up. Once you feel steady, place both feet firmly on the ground. Use a stable object for support if needed, and rise slowly. If you frequently experience dizziness or unsteadiness when getting up, you might also want to investigate whether any medications you are currently taking contribute to low blood pressure. Certain blood pressure medications, diuretics, and even some sleep aids can exacerbate the problem. Always keep a bedside lamp or nightlight within reach to ensure you can see clearly where you are going. And if you've ever felt sudden lightheadedness at night, consider discussing it with your physician. A simple alteration in how you get up can significantly impact preventing a dangerous fall. Comment "steady steps" below if you found this helpful. 2. Now, let's discuss the habit of consuming excessive fluids before sleep. Maintaining proper hydration is vital for overall wellness. But drinking too much water before going to bed can be more detrimental than beneficial, especially for seniors. As we age, the body's capacity to regulate fluids and process them efficiently diminishes. This implies that consuming large quantities of water in the evening can lead to frequent trips to the bathroom during the night, disrupting sleep and increasing the risk of dehydration, electrolyte imbalances, and even perilous nighttime falls. One of the most significant concerns is nocturia, a condition characterized by frequent urination during the night. Many older adults grapple with this without realizing the extent to which their evening fluid intake plays a part. When the bladder fills up too rapidly, it sends urgent signals to the brain, compelling you to wake up multiple times simply to relieve yourself. This persistent sleep disruption affects more than just rest. It weakens the immune system, puts strain on the heart, and even hastens cognitive decline over time. Poor sleep has been associated with elevated risks of dementia, heart disease, and amplified stress on the nervous system, making it crucial for seniors to maintain a consistent sleep pattern. But the dangers don't end with sleep disturbance. Every time you get up to use the bathroom at night, you are increasing the likelihood of falls and injuries. Navigating a dimly lit room when you are still half asleep can be disorienting. And for older individuals, even a minor misstep can result in broken bones or head trauma. Many nighttime falls occur due to a combination of low illumination, grogginess, and an urgent need to reach the bathroom swiftly. These risks are even greater for those with balance problems, low blood pressure, or weak leg muscles. Consider the experience of Lori, a 74-year-old from Maryland. She was diligent about drinking enough water throughout the day, but she had formed a habit of drinking a full glass of water right before bed. She believed it was a healthy practice, but over time, she started waking up more frequently to urinate. One night, in her haste to get to the bathroom, she tripped on the edge of her carpet and fell, fracturing her wrist. Her doctor later advised her to adjust her hydration habits to reduce nighttime bathroom trips and minimize the risk of future falls. The solution isn't to eliminate water altogether, but to time its consumption wisely. Instead of drinking large amounts of water in the evening, concentrate on hydrating earlier in the day. Aim to consume the majority of your fluids in the morning and afternoon, and then gradually decrease your intake in the evening. If you often feel thirsty at night, take small sips instead of a full glass. Additionally, avoid caffeinated and alcoholic beverages before bed, as these act as diuretics and can worsen nighttime urination. Comment hydration habits below if you found this tip useful. I believe you're enjoying this video. Before we continue, make sure you subscribe, like, and share this video. Comment wonderful if you're enjoying this video. 3. Now, let's talk about the habit of keeping the bedroom excessively cold. Many individuals enjoy sleeping in a cool room, but for seniors, an environment that is too cold at night can pose significant health hazards. As we age, our bodies become less efficient at regulating temperature, making it more challenging to stay warm during sleep. A drop in body temperature at night can restrict blood circulation, elevate the risk of strokes and heart strain, and even lead to respiratory problems. What feels like a slightly cool room during the day can become dangerously cold during the night when the body's metabolism naturally slows down. One of the primary dangers of sleeping in a cold room is vasoconstriction, where blood vessels narrow to conserve heat. For seniors with pre-existing heart conditions, this process can place extra stress on the heart, increasing the risk of high blood pressure, irregular heartbeats, or even heart attacks while sleeping. Furthermore, cold temperatures can cause blood to thicken slightly, making clot formation more likely, which elevates the risk of strokes. Even mild exposure to cold night after night can gradually wear on the cardiovascular system, leading to unexpected complications over time. Another often overlooked risk is how cold temperatures can weaken the immune system. The body works diligently to maintain a stable internal temperature, And when it's exposed to excessive cold, immune function slows down. This can make seniors more susceptible to colds, flu, and respiratory infections, which can be more severe or last longer in older adults. Sleeping in a cold environment with dry air can also cause nasal passages to dry out, leading to increased congestion, sinus issues, and a higher risk of respiratory infections. Take the example of Anita, a sprightly 78-year-old from Virginia. She preferred sleeping in a cool room and would often lower the thermostat before bed. Over time, she started waking up feeling stiff, with mild headaches and occasional shortness of breath. Initially, she didn't think much of it, but after experiencing chest discomfort on a particularly cold night, she decided to consult her doctor. It turned out that the combination of her mild heart condition and the cold nighttime temperatures was putting excessive strain on her cardiovascular system. By adjusting the temperature in her bedroom and using additional blankets instead of lowering the thermostat, she was able to sleep more comfortably without added health risks. To minimize these dangers, it's crucial to maintain a stable and moderate bedroom temperature. Ideally, seniors should keep their room comfortably warm, but not too hot, around a temperature that allows them to sleep soundly without feeling cold. Instead of drastically lowering the thermostat, opt for extra layers like warm blankets, socks, or thermal sleepwear. Using a humidifier can also help prevent the air from becoming too dry, reducing the risk of respiratory irritation. For those who struggle with circulation issues or arthritis, keeping a warm water bottle near their feet or wearing light gloves while sleeping can also help maintain a steady body temperature. Making these small adjustments can help prevent unnecessary strain on the heart and immune system while promoting better sleep quality. Being mindful of nighttime temperatures can make a significant difference in long-term health and well-being. Comment warm nights below if you agree that a comfortable temperature is key for good sleep. 4. This time, let's address the critical mistake of ignoring chest discomfort or shortness of breath. One of the most perilous errors seniors can make at night is dismissing mild chest pain or difficulty breathing as something insignificant. Many individuals assume that if the pain isn't severe, or if it eventually subsides, it must not be a serious issue. However, the truth is that nighttime, when the body is most vulnerable, and seemingly minor warning signs can sometimes be the initial indication of a much more serious underlying problem. Ignoring these symptoms can be a fatal mistake, as they are frequently early indicators of a heart attack, stroke, or other life-threatening conditions that demand immediate medical attention. The primary reason these symptoms are often disregarded is that they don't always manifest in the way we typically expect. For example, a heart attack doesn't always present as sudden, crushing pain in the chest. In older adults, it can manifest as mild unease, pressure, or a peculiar burning sensation that feels more like indigestion. Shortness of breath might seem like a minor inconvenience, but it could actually be a sign that the heart isn't pumping blood effectively, leading to fluid accumulation in the lungs. These symptoms can begin subtly, making it easy to dismiss them until it's too late. The danger of neglecting nighttime chest discomfort is that heart attacks and strokes are more prone to occur during the night or early morning hours. This is attributed to natural fluctuations in the body's hormones and blood pressure while we sleep. The heart has to work harder during this period, and if there's already an existing issue like blocked arteries or high blood pressure, this added strain can trigger a sudden cardiovascular event. If someone experiences these symptoms but decides to wait until morning, they might not wake up at all. Consider the experience of Melvin, a 79-year-old from Illinois. He occasionally felt a dull pressure in his chest at night, but since it wasn't acutely painful, he assumed it was just heartburn. One evening, he woke up feeling slightly winded, but he told himself it was nothing to be concerned about. He drank some water and went back to sleep. The following morning, he collapsed while getting out of bed. His family later discovered that he had suffered a mild heart attack during his sleep. And because he hadn't sought medical help earlier, his heart had already sustained significant damage. Had he called for medical assistance the night before, the outcome could have been very different. If you ever experience unusual pressure, tightness, or discomfort in your chest, do not ignore it. Even if the pain isn't sharp or intense, it's always prudent to err on the side of caution. Shortness of breath, dizziness, cold sweats, nausea, or discomfort that radiates to the neck, shoulders, or arms should never be taken lightly. If you experience any of these symptoms at night, do not wait until morning. Call for emergency help immediately. It's always better to get checked out and discover that it was nothing serious than to risk ignoring a potentially life-threatening event. Being attuned to your body and recognizing when something feels amiss is one of the most vital things you can do for your health. Your body provides warning signals for a reason. Heeding them could save your life. Listen to your body below if you understand the importance of acting on these warning signs. 5. Moving on, let's delve into the habit of sleeping immediately after consuming a substantial meal. Many people enjoy a late-night snack or a large dinner before going to bed. But for seniors, eating too much too close to bedtime can have serious health implications. While it might seem harmless, lying down too soon after eating can trigger acid reflux, disrupt digestion, and even elevate the risk of more severe conditions like aspiration pneumonia or heart strain. The body's metabolic rate slows down at night, making it more challenging to process heavy meals efficiently. This can lead to discomfort, poor sleep quality, and even dangerous complications over time. One of the most immediate risks of eating a heavy meal before bed is acid reflux, also known as gastroesophageal reflux disease GERD. When you lie down with a full stomach acid can easily flow back into the esophagus, causing heartburn, coughing, and irritation. Over time, repeated acid exposure can lead to inflammation, ulcers, and even an increased risk of esophageal cancer. For seniors who already struggle with digestive issues, the effects can be even more pronounced, making it difficult to get a good night's rest and leading to chronic discomfort. However, acid reflux isn't the only concern. Eating large meals late at night can also place unnecessary strain on the heart and circulatory system. Digesting a large meal requires increased blood flow to the stomach, which can temporarily divert blood away from other vital organs. This can lead to a drop in blood pressure, making some seniors feel lightheaded or fatigued. In individuals with pre-existing heart conditions, this added stress can contribute to irregular heartbeats or even an increased risk of heart failure over time. Another serious, but often overlooked danger is silent aspiration, a condition where small amounts of food or stomach acid accidentally enter the airways instead of going down the digestive tract. This can happen more easily when lying down soon after eating, especially in seniors who may already have weakened swallowing reflexes. Over time, repeated episodes of silent aspiration can lead to chronic lung irritation, infections, and even aspiration pneumonia, a dangerous condition that can be life-threatening for older adults. Take the example of Stanley, a 75-year-old from Texas. He enjoyed his evening meals and often ate late due to his variable schedule. One night, after having a large dinner, he felt mild discomfort but dismissed it and went straight to bed. A few hours later, he woke up coughing and feeling short of breath. What he didn't realize was that some of the stomach acid had entered his airways, leading to irritation in his lungs. Over time, he began developing a persistent cough and occasional wheezing. His doctor later diagnosed him with aspiration-related respiratory issues and advised him to change his eating habits to prevent further complications. The most effective way to mitigate these risks is to time your meals appropriately. Instead of eating a large meal right before bed, try to finish your last substantial meal at least 2 to 3 hours before lying down. If you do feel hungry late at night, opt for a light, easily digestible snack like a banana, yogurt, or a small handful of nuts rather than a full meal. Elevating your head slightly with an adjustable bed or extra pillows can also help prevent acid reflux while you sleep. Making these simple adjustments can improve digestion, support heart health, and reduce the risk of nighttime respiratory issues. Small changes in your evening habits can significantly contribute to protecting your health and ensuring a more restful sleep. Comment digestive health below if you found these dietary tips helpful. 6. Finally, let's consider a crucial point that ties everything together: neglecting to seek medical advice. While the previous 5 points highlight specific dangerous nighttime habits, perhaps the most significant danger lies in ignoring persistent or concerning symptoms and not consulting a healthcare professional. Many seniors might attribute new or worsening symptoms to aging or other minor causes, delaying or avoiding necessary medical attention. This reluctance to seek professional help can have dire consequences, especially when dealing with issues like chest pain, shortness of breath, or recurring dizziness. Early diagnosis and intervention are often critical in managing and treating many health conditions, and delaying treatment can lead to more severe complications and poorer outcomes. If you experience any of the issues discussed in this video or any other new or concerning symptoms, it is vital to reach out to your doctor promptly. They can provide an accurate diagnosis, recommend appropriate treatment, and offer personalized advice to help you stay healthy and safe. Don't hesitate to discuss your nighttime habits and any related health concerns with your physician. Remember, your health is your most valuable asset, and proactive health care is essential for maintaining a good quality of life as you age. As we conclude this video, take a moment to reflect on the 6 nighttime habits we've discussed. While some of them might seem insignificant, they can silently increase health risks over time, particularly for seniors. The good news is that making small adjustments to your nighttime routine can make a significant difference. By modifying your habits, you can protect your heart, improve your sleep quality, and reduce the likelihood of unexpected medical emergencies. Which of these habits surprised you the most? Have you ever encountered any issues related to nighttime health before? We would love to hear your thoughts. Your experiences could assist others who might not be aware of the potential risks involved. Taking care of your health isn't just about what you do during the day. It's also about the choices you make at night. Your body needs time to recover, and making smarter nighttime decisions can help you remain strong and healthy for years to come. If you ever feel uncertain about how a particular habit might be affecting you, don't hesitate to consult your doctor. It's always better to be safe than sorry. Thank you for joining us today. We encourage you to leave a comment below and share one thing you learned from this video and how you plan to implement it in your life. Your feedback is valuable to us, so please don't hesitate to share your thoughts. Reading your comments provides us with great motivation and encouragement. If you found this video informative and helpful, please subscribe, like, and share it with others who might benefit from this information. Your support helps us continue creating valuable content to inform and inspire you. Before you go, be sure to check out our other interesting videos on this channel for more health and wellness tips. Thanks for watching, and we look forward to seeing you in our next video.